If you're watching this, chances are you're either not getting the results you want from Tadalafil, or you're about to start and want to make sure you're doing it right. The truth is, most guys use this medication wrong and never see its full power. But today, I'm going to show you exactly how to unlock its maximum effect. So stick around, because you won't find these secrets anywhere else. First, let's briefly put ED into context. Did you know that around 10% of men under the age of 40 will experience ED at some point? And for men between 40 and 70, the number jumps to almost half 30 to 50%. So if you're struggling with this, know that you're definitely not alone. The good news is that there are effective treatments available, and Tadalafil is one of the best known options. Tadalafil belongs to a class of medications known as phosphodiesterase type 5 inhibitors, PDE5 inhibitors, along with others like sildenafil, better known as Viagra. These medications are vasodilators, which means they help increase blood flow to the penis. This leads to firmer, longer-lasting erections that can help restore confidence in sexual performance. But here's the catch. Many men report that Tadalafil doesn't work as well as it used to, or doesn't work at all. Often, this isn't because the medication has stopped working, but because of how it's being used. That's why I put together these 5 key tips, so you can make the most of every dose and get back to feeling your best. Tip number 1, choose high-quality medication. One of the most overlooked parts of ED treatment is making sure you're using medication that you can trust. There's a lot of debate about whether generic Tadalafil is as effective as the brand name versions like Charlie's. The truth is, generics can be just as good if they're from reputable sources. Always buy your medication from trusted pharmacies or sources recommended by your doctor. Urologists often suggest well-known brands because they're proven and consistent. If you're not sure about the source of your medication, it's better to double-check, because quality matters when it comes to something as important as your sexual health. Tip number 2, take it on an empty stomach. Here's something that surprises a lot of people. The foods you eat can affect how well Tadalafil works. Heavy meals, especially those high in fat, can slow down how your body absorbs the medication. And let's not forget, alcohol drinking before taking Tadalafil can also reduce its effectiveness. So if you're planning to take it, aim to do so on an empty stomach, or at least a few hours after a big meal. This can significantly improve how the medication is absorbed, making sure it reaches its full potential. Tip number 3, don't forget sexual stimulation. This is a big one. A lot of people think that Tadalafil is like a magic pill. You take it and boom, instant results. But that's not exactly how it works. Tadalafil helps improve blood flow, but it doesn't trigger an erection on its own. Sexual stimulation is still essential. So make sure you're engaging in activities that turn you on, whether that's intimate touch, sense, or whatever works for you. Reading a book or watching TV after taking the medication won't help. You need to be physically and mentally involved for Tadalafil to truly kick in. Tip number 4, use the right dosage. This might sound obvious, but a lot of men aren't using the correct dose. Tadalafil typically comes in 2 main strengths, 5 milligrams and 20 milligrams. The 5 milligrams dose is usually meant for daily use. It's a low-dose option that keeps the medication in your system all the time, so you're always ready for sexual activity. But if you're using it on demand, meaning only when you plan to have sex, the 20 milligrams dose is generally the most effective. Using the right dosage can be the difference between mild improvement and maximum effect. Similarly, if you're trying sildenafil, Viagra, the typical doses range from 25 to 100 milligrams, so make sure you're using the one that's right for you. Tip number 5, time it right. Timing really is everything. Most people take Tadalafil 30 minutes to an hour before sexual activity, which is fine, but if you want to get the most out of it, consider taking it 1 to 2 hours beforehand. Tadalafil can stay in your system for up to 36 hours, but its peak effectiveness is usually in the first 10 hours after taking it. So by giving yourself that extra hour or 2, you're ensuring the medication has fully absorbed and is working at its best when you need it most. Bonus insight: when pills aren't enough. Now, let's say you've tried all these tips and you still feel like you're not getting the results you want. First, talk to your doctor. There could be other factors at play, like underlying health conditions or hormonal imbalances. But it's also worth knowing that there are natural methods out there that can help support sexual health without relying solely on pills. One example that's gained a lot of attention lately is a simple 7-second ritual that's been helping thousands of men worldwide restore their sexual vitality naturally. While it's not a replacement for medical treatment, it can be a great complement. If you're curious, there's a link in the description you can check out. So let's recap. To get the most out of Tadalafil, choose high-quality medication from reputable sources. Take it on an empty stomach for better absorption. Make sure you're getting plenty of sexual stimulation. It's essential. Use the correct dose for your needs, 20 milligrams for on-demand, 5 milligrams for daily use. Time it properly, ideally 1 to 2 hours before sex for best results. I hope these tips help you feel more confident and get back to enjoying your sex life to the fullest. If you found this video helpful, don't forget to like it and subscribe to the channel so you never miss out on our weekly videos. And hey, if you know someone who could use this information, be sure to share it with them. Thanks for watching, and I'll see you in the next video. Stay healthy and take care. This video is for educational purposes only and does not constitute medical advice. Always consult with a qualified healthcare professional before starting or changing any treatment. Results may vary based on individual circumstances.